Tomorrow is the day of my surgery, facial feminization surgery, breast augmentation. Hello everyone, this is Layla. I'm back here at IMED Medical Istanbul for a second round of FFS and a breast augmentation, 3 years after the first round, and I'm super excited. I changed my beautiful robe now. We did all the medical checkups and now we're gonna see Dr. Turgut for the last consultation before the surgery.
Hello Layla, welcome. How are you?
Long time ago.
Yes, exactly.
You too, you look good.
You look gorgeous. Okay, Layla, welcome again.
Okay, I think first we're gonna make pictures and then we can talk what we are gonna do.
Sure.
Okay, then we will take, come here please, we will take your face pictures.
Also, I want them to be closer. I don't know if it's possible to detach the skin a little bit.
Okay, I placed your implants as dual plane. I can see your muscle here. I will detach it in some places around here. You can see there is a small. I will be going full endoscopical, which means I will hide your incisions as in previous operation. I will hide your incisions. I will use your old incisions to access the areas. First, you want probe 1 shaving. I do type 1 shaving. Actually, you don't need type 3. It will be too much, which means I will be shaving and I will be shaping your brow bone. So I won't be removing bone and putting it back, no screws and other things. In safety margins, I will first be shaving this your sinus wall, this frontal area. I will make it smoother.
I don't want actually too much.
Okay.
Not so flat. I don't like the flat result. I just want really lifted.
Okay, and to get this lifted effect, we have to make this smoother because this bone access is a little bit too big. So around this orbital rim, I will be shaving this area. It will be getting us a smooth look. Nothing crazy,
and also
nothing
it's not,
depressed.
This one actually is going out more than this
Yeah,
side.
a little bit, not too much. This bone is bigger.
Yes.
So this one is smaller. Okay, we will be doing this shaving. Do you want shaving around this area or not? We can keep it. It's not excessive. It's giving a nice bulge, nice roundness. Nothing, I can say, nothing muscular.
It never shocked me, honestly. It's more this.
Okay,
but I feel very aggressive.
in the future, actually, as you lose fat, we will get an look that your eye will be looking like in a socket, a ball in a socket. So, because your eye will be shrunken and it will be more visible. So we are actually preventing that look also.
Yes.
When you take a photo, of course, there is a shadows around this area. And it's making you look a little bit tired.
Exactly.
So you will be looking more energetic, more refreshed. So I will be shaving mostly around this area. We will be getting a smoother look.
And I also want my eye actually to follow
More.
that line.
Okay. Again, I checked your previous photos.
Yes.
It's also looking, your contopexy looking more. You want more. Look at that. It was really very asymmetrical and you can see this area we did more. So we have very nice, it was more on this side and smaller on this side. We call this scleral show. This white part is more visible.
Yes.
In this side, it's less visible, for example. We did contopexy, and you want more extreme result?
Just a little.
So we will be doing contopexy, that cat eye surgery, okay? And I will be doing this temporal lifting from here. Do you want full brow lift or lateral lift? Okay.
This is good. I don't want my brow to be higher.
Okay, then we will have only 2 incisions, only your temporal areas. I won't be making incision here. Both of incisions will be here. It will be around 3 centimeter long. So there will be less incision also.
Okay.
And we also did mid-face lifting in the previous surgery.
Yes.
Okay, I will increase a little bit on that side. I won't be doing full lifting again because it's holding real very well.
Yes.
But I just want to make some fat injections because I saw in your edits you want very chubby face.
I want baby face, brown.
Okay.
The thing that I don't like right now is that we see like this skeleton shape, you know, the hair is going inside, the big cheek, and then here going inside again.
Yes.
So I want here to be, you know, full, and then maybe a little bit here.
You want fat injection around here, temporal areas,
And maybe just
under your eye area.
Under the eyes as well.
I think we should do this. And
here.
That side.
Yes.
Okay. Yes, around this area your volume is less. We will be adding volume. Okay, that's good. We can do this. Yes. Logical. It won't match.
Next step.
Next step, your nose. But if you want, I can from here. I can make it thinner. It means I can cut your bones and push them a little bit more. Otherwise, this area looks perfect. I will open this area. I will increase this. I will maybe remove some cartilage here. Most probably I put cartilage this area to support your nose because it was very weak. Now look, this is strong nose, and it has been 3 years at least, and it's very strong. You have no issues. Everything is very nice. Since it was a deviated crooked nose, because I always say there is no guarantee. So I don't want to risk anything. I will make small opening here. I will make small shavings around here. I will make small slope. Nothing crazy.
Not too high.
Okay.
I want very cute.
For your chin.
Too big. It looks so big. It looks bigger than, you know, the 3 parts. So I want cuter, smaller.
Okay. For me, we can do genioplasty, which means I will open this side from inside of your mouth, and I will remove some part of your bone around here. We will cut this bone. We will remove, and we will shave these areas a little bit. I will go a little bit to these sides. Not more. So, and for your soft tissues, I will take them out and I will carry them up. So this area will be shorter, lifted.
And more in front?
No.
No?
It will be too much.
Okay.
It means sliding, we call it sliding genioplasty. We put this removed bone and we move it a little bit forward and we put screws. If we do this, it will be so long.
From the profile, you don't think it's a little bit inwards?
No, it's just long, wide.
Yes.
I understand this is okay. But Zübeyde told me you want jawline. If you ask me, it looks perfect. Everybody wants this look. This is not masculine. This is a nicely drawn, very nice jawline.
I feel like
we do fat injections, fillers to achieve that look.
I know. I don't like. I feel like this length is too long.
When we put fat around this area, it will look much better.
Yes.
Yeah.
No need to remove 1 centimeter.
We can do small fat Botox injections if you want. It will be smaller. It will be enough.
And it will be also sagging.
Yeah, when we remove bone this area, this skin will be softer and it can sag. There is also always risk. In suitable patients, I do this operation. It's very popular. They call V-line, etc., etc., but it's not suitable for everybody. For your nose, this jawline area doesn't look masculine.
Okay.
It looks nicely drawn. Very nice. It's looking perfect. Okay, for this area we can do it.
Yes. I will not have any skin going because I feel like right now my skin is blue.
I will do which we call mentopexy. I will take out these soft tissues and your muscle from inside, and I will be fixing them to your bone here. At first you will see it's a little bit like a ball. It will be hard, and I will be pulling them up. So risk is very low.
Perfect. I think it's gonna look amazing.
Yeah, you are looking perfect.
Thank
Okay,
you.
it's very nice, and it has been 3 years. Your face is really very good.
Thank you,
I'm really
doctor.
proud of your face, your breasts. We will do some improvements. Okay, so change won't be so big like previous operation.
Yes, for sure.
You have to know this.
I know.
And the biggest change on your face, if you ask me, will be around this area and this
I
area.
guess so. This is what I want.
Yeah.
I'm excited.
Yeah, done. Operation will be around 3 hours,
Oh,
maybe
it's alright.
4 hours.
She was
Swelling
scared.
will be crazy again.
Yes, I
It
know.
can be crazy. You are a little bit unlucky about this swelling.
Thank you, doctor.
You're
See you.
welcome, dear.
So the consultation was very great. I just saw the doctor and I'm super excited. He understands fully what I want to do. And now I have to wait 3 hours and then I'm next online for the surgery. I was nervous, but right now when the doctor listened to me, everything went well. So I'm super excited. So see you after the surgery. Mwah.
I understand. When I saw your bone anatomy, I got you. Yeah. But there was so much filler. Even your muscle is filled up filler and destroyed a little bit of your muscle. I cleaned most of them that I could remove, and I fixed your muscle around here, so it will be lifted and nice, and your chin will look better. Yes, it will be looking lifted from it. In this area, as you remember, there was some contraction. I opened it, and I fixed here because I made an internal brow.
Everyone, so it's been 3 months now since my FFS revision. I've had my chin shaved for a more feminine and smoother look. Some fat injected in my temples. Rhino revision to get it thinner, and a brow bone shaving, and of course my new boobies, which are 700 cc each side. And I'm super happy of the look. It looks more feminine, more smooth, and yeah, I look more snatched. This is without filter, just some concealer on, so you can really tell before and after.